Hi everyone, this is Casey, and it's been a little bit since I have made a video for this channel. Things are wacky. There's a global pandemic. I live in New York, and we are basically sheltering in place, but we're not calling it that. As you can see, I'm in my car, so clearly I wasn't in my home, but this is the first time I've been out of my home or out of my apartment complex in a week. Before that, we had only been seeing my parents and hadn't going to stores or anything like that, even previously, based on what my rheumatologist had told us to do because of both of us, really, me and my partner, being in high-risk group due to having autoimmune diseases. But I wanted to make this video today because we are basically under lockdown here in New York and only supposed to leave for medical appointments or to go to necessary businesses, or if you are a essential employee, and if you're in a high-risk group, you're really supposed to be seeing no one except for medical visits. You're really not even supposed to be having visitors or going over to like your parents' house or anything like that. We're not allowing, like if my parents drop off supplies to us, they're leaving it on our patio. If we talk to them, we're doing it outside from at least 6 feet apart. We're not allowing our son, who is a toddler, to interact with them in any way because he can be a carrier and he could infect them, for instance, or if they have it, he could hug them and infect us. But anyway, moral of the story, I'm making this video because I got my second biologic infusion treatment for my psoriatic arthritis today. As you can see, my psoriasis itself is like pretty out of control. It's gotten a lot worse since the last treatment. But I wanted to say that I am still getting my treatments. It has been my rheumatologist's recommendation that I do so because they don't want tons of people in flares also flooding the hospital system, in addition to people who have COVID-19 or seasonal flu or any of these things. And because yes, our treatments can suppress our immune system, but our immune system is also super out of whack if we are not treated. And so their recommendation is to continue treatments as usual. And I wanted to say that, I was scared to go. Obviously, I'm not going to know for 2 weeks if I got infected from this. It's impossible to say, and that is a risk that I had to take. And I'll update you in 2 weeks, and then you'll know too. But they are doing everything they can at their office within reason. Obviously, they don't have an unlimited supply of masks and personal protective equipment there because the hospital systems need it. People that are actively sick need it, but they are sanitizing everything between patients. They're restricting who can even come into the office. Pretty much only infusion patients are going into the office. Everyone else is telehealth. They're sanitizing their hands. They've cut their staff. They're being as careful as they can. So I did go. It was very scary, but I did it. My partner stayed home with my son. My dad met me there for moral support. And now I'm back. I'm expecting to probably be real tired for the rest of the week. The infusion was less scary this time, easier, because I knew what to expect. It was probably took 20 minutes. I had my normal follow-up appointment at the same time that I was getting the infusion. And the only other thing I wanted to say, I guess 2 more things. One is about my own symptoms and how the treatment is going. I felt worse after 1 week after my first infusion, but I did get probably about 30% better with a lot more mobility in the following couple of weeks, and then started to feel worse again. As I mentioned, my skin psoriasis has gotten worse. My digestive issues have been somewhat better. And so it's actually a little bit unusual to have a response after the first treatment like that. So my treatment team feels like that was very promising. And I'm hoping something similar happens this time. So I know I made a somewhat bleak video after the first week after the treatment because I felt worse, but I did feel significantly better after that. I have had a lot of hip pain, pelvic pain, back pain, because I do have multiple back problems, some caused by the psoriatic arthritis, others not. And They think that part of that might be because I did have actually significantly increased mobility and did a lot more because my knees were feeling better. I was less stiff. I was able to walk around. I was able to stay, somewhat more active throughout the day, sit on the floor, get up, increase my physical activity. So that happened. That was somewhat promising. I'm hoping to have good results this time as well. And it was less scary. The last thing that I want to say is to everyone out there who is not in a high-risk group, stay home. Stay home if you can. Follow the recommendations. Wash your hands. Use hand sanitizer. Do not go to a gathering. Do not let your children play with other neighborhood children. This is a serious situation. And people like me who are at an increased risk, people like my parents who are at an increased risk, people in nursing homes, people who have recently had chemotherapy who are at an even higher risk, people with asthma, people with cystic fibrosis who are at a higher risk even than me, need you to stay home. And as a population, we need you to follow the recommendations, because this will be so much worse if people do not. It will be so much worse. And I know the economy's bad, but if we have repeated rounds of this because we don't follow through with safety measures and containment measures on the first try, on the second try, and go strict at the beginning, it's going to repeat. It's not going to just taper off if we come out of our various lockdown type procedures too soon. And I am not any kind of medical professional, so read what they are saying. Read what the CDC is saying. Read what the trajectory has been in other countries that have had various responses. And if you are in a position like me where you are at high risk, I'm not asking you to go do all this research, because you don't need to stress yourself out more. You know what you need to do to protect yourself and your family and the population, I would imagine. And also, don't hoard stuff, because there are poor people, there are people who don't have reserves, there are people who don't have an income right now, who can't get these things because the people who do have the resources to are hoarding them, and that's not okay. And it's also not okay that there are people who don't have autoimmune diseases and who do not have COVID-19 who are getting their doctors to write them prescriptions for plaquenil. There are people out there with rheumatoid arthritis, with lupus, with psoriatic arthritis, with ankylosing spondylitis, with all of these other conditions who need to be taking plaquenil, because it is what keeps them healthy. It is what allows them to function. It is what keeps their body from attacking itself. And there are people who are hospitalized with COVID-19 and people who are trying to conduct research studies who need access to it. You at home who want to take it prophylactically or want to hoard it, or want to convince your doctor or call my doctor or whatever, you should not be doing this. That is not okay. There are people who can't get their refills right now. There are doctors who are writing themselves prescriptions for themselves and their families that do not need to have this on hand. That is not how we need to be acting right now. The people who need it should have it. And those are people who have active prescriptions, who have autoimmune disease, or who might need prescriptions for it for autoimmune disease in the future. And the doctors and healthcare facilities who are conducting studies on it with critical COVID-19 patients. That's who needs access to plaquenil, not random people who heard Trump talk about it in a tweet and now want to have it on hand. And also, it's not something that is just Tylenol that you just pop. It is safe when used appropriately, because what it's used for are serious things, and it is safe compared to those things. But this is a medication that has side effects, that can have long-term permanent effects, that no one should just be taking. So if this is not something you are prescribed for a really good reason, do not call your doctor about it. Do not call your pharmacy about it. They have other things to do. They have actual patients to treat. And you want that to be available if it actually does work. That and azithromycin, two of the things that are being tested right now, you want those to be available in the hospital if that is where you need to be. Not hoarded in your apartment or your neighbor's house or whatever. And I'm sorry if I seem upset about it, but it's just not. That's a medication that my partner took for a long time. It's a medication that I was almost prescribed before I went on biologics. And it's not something to mess around with, and we don't need to be the Wild West right now. We really don't. Like, that is not going to help anyone except the people who always come out on top all the time because they have the most resources. And the people who are going to be most affected by this and are being most affected by this, both medically and economically, are not those people. So follow the recommendations of your local government, of your local health department. And if they haven't put in strict recommendations, I would urge you to contact them and ask them to. Because we need a national strategy, not a patchwork strategy where states are fighting each other for supplies and where we're passing this virus back and forth because we don't have a national strategy. So that's what I have to say as someone who is in an at-risk group who has an autoimmune disease. I'm doing about the same. I felt better for a couple weeks. Now I feel worse again, and I just got my infusion. I do feel scared about it. I feel scared about my immune system. I feel really scared about this and how it could personally affect me. And I'm one of the people that needs everyone to do the right thing. So, do the right thing. And I'll check back in with you and let you know how it goes, how self-quarantine is here in New York with me and my partner and my son in our apartment, where it's a little harder. It's a little harder to self-quarantine when you have to go to common areas to get your mail and to go outside and to, do your laundry. So I'll keep you updated. Thank you for watching, and wash your hands. Stay away from people.